Hello and welcome to the Healthcare Leadership in Action podcast from the Faculty of Medical Leadership and Management. My name is Kirstin and I'm the Director of Research at FMLM. This second series is focused on postgraduate leadership development and assessment. It is sponsored by the Dinwoody Charitable Company as part of a project to improve leadership development and assessment for doctors in training. Hello, welcome to this episode of the Healthcare Leadership in Action podcast. I'm Kirstin Armit, Director of Research at the Faculty of Medical Leadership and Management. Today we are talking about the developmental conversation. I am joined by Dr. Daljit Hothi, Paediatric Nephrologist at Great Ormond Street and Director of Leadership Development at the Faculty of Medical Leadership and Management, Justin Poisson, Associate Director of Education at the Great Ormond Street Learning Academy, and Dr. Keerthini Muthuswamy, Radiologist at Guy's and St Thomas's NHS Foundation Trust. Welcome everyone, thank you for joining. So today's episode is about the developmental conversation, and I'm interested in what is a developmental conversation from your point of view? Why do we have them and why are they important? So Dal, can I start with you?
Yeah, of course. Thank you for inviting us here today, Kirstin. For me, I think there's three components of why developmental conversation is important. The first is to grow your thinking, if you like. The second is to expand your knowledge. And the third is really to start to evolve different perspectives and incorporate those into your own thinking. And ultimately, I think it's something about either becoming more knowledgeable, and I think that's the horizontal development, and that's about the knowledge, or it's about becoming wiser, and that's the vertical development. So how do we become more sophisticated in our thinking, in our approaches, in our perspectives? So that's the element for me.
Great, thanks very much, Dal. We'll come back to some of those points shortly. Justin, can you tell us from your point of view what a developmental conversation is?
Thanks, Kirstin. I think, just to echo some of the things that Dal said, totally agree. I think they're essential to your educational development as a junior doctor, as a trainee. And, they take many forms. And it's important to sometimes think about, what conversations you have around clinical training and educational development as well, because they can be different. So the clinical training conversations generally focus on the practical skills and the application of knowledge in a clinical context. And the educational conversations tend to be a bit broader and can encompass learning that happens over an entire period, like your training placement. And your clinical training conversations tend to feed into your educational ones. And so it's important that you undertake that on a regular basis as part of your educational development.
Terrific. Thanks very much, Justin. And Kit, what's your view?
Yeah, sure. I think, I guess going back to the first part of your question, what is a developmental conversation? For me, I think it's quite a broad definition. I would say it's any conversation, be it formal, informal, short, long, in-depth, brief, that helps shape your thinking or your actions in any aspect of your life. So be it professional or personal. So that's just very, very broadly speaking. But I think they're very important. I think kind of reflecting on what Dal said as well, because I think an important part of reflection is having different perspectives on things, as it's otherwise very easy to get caught up in your own thoughts. And I think having these conversations is a really important way of bringing in other perspectives, almost as a self-checking mechanism, and to challenge yourself to think in other ways.
Excellent, thank you. So several different perspectives on the importance of the developmental conversation here. I'm going to ask for some practical examples of the types of conversations that you have had. Could I come to you first of all? What's any examples from your own experience about developmental conversations that you've either led or that you have had when you were training?
Yeah, sure. I think, again, the potential, because based on what I said, my definition of a developmental conversation is, I think the potential is really broad with regards to the type of conversations you can have. And I think there are many different lenses you can use to look at these conversations and frame them. I think in my experience as a trainee over the past few years, they've been, broadly speaking, either quite objective. So I think, as Justin was saying, the kind of clinical skills-based conversations where you're talking about your clinical skills and progress that you've been making quite objectively. I think there's also other conversations where you're reflecting upon specific instances. So I did the FMLM National Medical Directors Clinical Fellowship, and as part of that, I had several instances where I would be, for example, presenting in a meeting with several more senior leaders, and actually quite often after those situations, we would come back and I'd have a debrief with my supervisor about how it went and thoughts about that. So that's kind of a more specific developmental conversation. And I think there are more broader conversations as well that I've had that have been centered more around my approach to leadership and how I think about my values and what's important to me in the way I approach leadership. And that's been with my supervisors at work, actually my clinical supervisors at work, but also during my management fellowship. So that's been really useful in just kind of shaping my approach to how I look at situations.
Great, thank you. And Dal, what about from your point of view?
Yeah, I think there's so many ways of categorizing this. You talk about lens, Kirstin, but there's so many different ways of approaching this. So the simplest, I think, that we often come across is the clinical versus non-clinical. We often say we have leadership conversations and then have a separate conversation about your clinical work. Whereas I think as a clinician, you are constantly demonstrating leadership qualities, competencies, skills, but we sometimes separate those. So I think one of the things one can do in terms of your developmental conversations is to have a conversation about your clinical acumen, your clinical skills, your clinical knowledge, but then say, well, how did you bring in the leadership component to that? And that could be decision making, it could be influence, it could be how you've led services, how you've supported patients. So I think that's one of the things that we sometimes marginalize is the leadership component of clinical work. So that's my first point. I think the second is the lens of where's the work being done? Is it being done about yourself? Are you supporting your own development? Is it my self-awareness or my impression of self and my self-complexity? Is it about teams? Is it about organizational work, or is it system work? So again, different lens can be applied on that same leadership conversation. And it really, I suppose the reality is there's so many different ways of approaching it that actually there's no wrong way or right way. It's just saying, let's broaden your perspective and your thinking and your awareness of how you might be behaving as a leader or how you may be leading your work as a clinician.
I think that's a really important point about actually integrating the clinical and the leadership as part of any conversation and broadening that perspective. It does lead to a question about what is actually needed for developmental conversations to take place and to be effective. And Justin, I wondered if you could share some of your experience about what does it take for a developmental conversation to be effective.
So I think some of the things we need for effective development conversations are a supportive and open environment. You definitely need active listening and clear communication. You need constructive feedback. But importantly, you need a mutual willingness to support and explore growth opportunities. Other things you need is trust between the trainee and the supervisor. It's so important. And focusing on collaboration rather than evaluation. It's not all about evaluation. And the point is to look at how we enhance the effectiveness of those conversations. And more specifically, I think if we're thinking about preparing and what we need for a conversation, I think I'm always a big advocate of preparing for educational conversations. And I think some of the things you can think about is self-reflection. I think we mentioned as well, setting goals, getting feedback, not just from your supervisor, but from your peers as well. Documenting conversations as well is important so that you have some clear outcomes and you know what you're working towards. As I said, active listening, having that open mindset, and some constructive solutions, I think, is important in order to get something out of it, linking it to your professional development plan. And once you have that plan, agreeing how often you're going to come back to it, I think is important as well. And making sure that the tone is right, that it needs to be a positive tone and it needs to be constructive.
Thanks very much, Justin. I think that's an interesting point that you make around finding constructive solutions. And I just want to pick up that maybe not everything has a solution. And I just wondered what you thought about that, going back to Dal's point as well, about having that growth mindset and sort of expanding your view, I guess, on the world and what you're kind of confronting. We know that healthcare is really complex, so perhaps not everything has a solution. What's your thoughts on that?
No, I think that's a fair point, but I think you need ways forward, and I think they need to be agreed with your support system, whether it be your educational supervisor and your peers, because your educational journey is not just tied into your supervisor, it's tied into the people around you. So there's something about finding constructive ways forward, and finding that support system to help you do that. You cannot do this alone. So you might not have solutions for everything, but you can find ways forward in a constructive way, and making sure that you have the right support and resources to do that.
So let's touch on the support system for a moment, because we've sort of talked about conversations between a trainee and their supervisor or their educational advisor. What else is in the support system that is helpful for these developmental conversations, and who else might need to be involved beyond the formal links to supervisors? So, Kit.
I think you're right, Kirstin. It doesn't have to be such a formal, the relationship is only between the trainee and the designated educational supervisor. I think one of my biggest reflections actually over my past few years of training and also during my management fellowship is that different people have different things to offer. And I think going back to my initial point about why these conversations are important, it's to bring in those different perspectives. So actually, I think it's about harnessing the wisdom, as Dal said, that's around you, and sometimes identifying who the appropriate person to have a certain conversation with might be. So that might be your peers. It doesn't necessarily have to be someone more senior to you. I think discussing a topic with your peers can be very, very helpful for your development. Often they can relate to what you're going through and actually have a different perspective to offer. Or even amongst your consultants or your more senior medical professionals, just identifying who might have expertise in a certain area, or even something as simple as who might be available to talk to you, just the logistical, more practical side of things. At certain points, some people are busier than others, and it's about recognizing that and again, being able to see who might be available to talk. And also, I think the other thing is it doesn't always have to be a formal conversation, just as it doesn't have to be a formal designated relationship. It's about also harnessing those micro conversations, so things you might have in the corridor and the workplace in a more casual basis, but just kind of being opportunistic and making the most of those opportunities as well.
That's a really important point, for especially at the moment, in the current context where there's so many pressures on people's time and availability to try and find time for those developmental conversations. So I wondered, Dal, from your perspective, what are your thoughts on the sort of formal, sort of planned conversations versus the micro conversations that might take place, and where can we take advantage of those opportunities?
I think this takes me to the point that sometimes we focus too much on the doing of the development conversation, i.e. the conversation itself, but there's a lot that's also needs to be done in terms of mindset and the commitment to these developmental conversations. So for me, I think anything that's a developmental conversation is bi-directional. There's got to be a commitment and mindset of the one who is supporting that development and the one who is participating in that development. So you've got to have a commitment from those who are wanting to be developed that they're going to be open to the conversation, the learning, perhaps even the candor and the honesty about where those opportunities of development are. At the same time, the person who is supporting the development has to be really committed to creating the environment, the psychological safety for somebody to be able to learn. And whether that be in a corridor, whether that be in a formal conversation in their office, but there is a really important commitment that has to take place. And I think sometimes we minimize or we don't consider that mindset, that commitment that needs to take place in both of those people. And I think if that mindset's there, the action will just follow nicely. Like you don't lose. But if that mindset's not there, then actually you can have a really good trainer or a really good trainee, and that conversation doesn't go as it should do.
Thanks, Dal. And Justin, in your experience of overseeing a lot of this, what have you sort of observed about what it takes to build that sort of psychological commitment and help people develop those mindsets and that commitment to development? And what do you do when people are not committed?
Sure. So I think what contributes to those healthy conversations is in a broader sense, a good culture within that department, making sure there's a culture of learning and development and growth within the department, and it just needs that good communication. I think good communication is key, and I think one that's that doesn't include assumptions. I think we can't take it for granted. Junior doctors move around hospitals very frequently, and so there can be some assumptions. People rotate in. We just assume that the development conversations have a standard format and that's it. We do the basic minimum and that's it. But actually, no. You need to cater your conversations to the trainee. Every trainee is different. They're going to have different educational and development needs, and actually trying to set that out from the beginning is important. Looking at your educational agreement. What do we want to achieve? And I always tell junior doctors when they come to Greater Ormsted Hospital, when I was during my time in PGME, and now when I meet new education fellows, is make sure you're clear about what you want to achieve during your time on this placement. Make sure you reflect and think about what you want to achieve, so that you actually have an endpoint. And then it gives you an opportunity to then think, what are the resources and support I need to achieve those goals? So having that reflection at the beginning, having clear thoughts and goals, and making sure that your supervisor is aware of it. But for supervisors as well, is asking those questions. What do you need? What are your expectations? And asking those open questions so that you develop that trust from the beginning at the start of that placement. Because the time flies so fast when you're working, then actually, you tend to miss a lot. And so having that set up that relationship from the beginning is really important.
Thanks, Justin. I think one of my observations has been that sometimes when people focus on achievements, it tends to be focused around ticking boxes, and obviously there is an important point. There are certain things that need to be achieved through clinical training and need to be able to be demonstrated. But I just wonder, going back to Dal's point a little bit earlier about that mindset, that appetite for learning, I guess, beyond the boundaries of just the day-to-day kind of clinical interaction and the techniques that might need to be learned. Sort of seeing the bigger picture, I guess. How do we encourage people to, I guess, see the bigger picture of what's going on around them? And Kit, can I come to you on that one?
Yeah, I think that is a tricky one, because quite often it's really easy to get caught up in the clinical work, because that's what we feel we come into work to do. As you say, those are the milestones that we have to get ticked off. So very often the focus is on achieving the next milestone and progressing to the next level. And I think the more unwritten or kind of less objective parts of it, like the leadership development that aren't necessarily a tick box exercise, can get neglected. I think it's difficult to put the onus on any one side. As Dal was saying, it's a very much a bi-directional thing. It has to come from the trainee's side and it has to come from the supervisor's side. And in terms of how to nurture that, I guess having that workplace culture goes very far. I think if someone is coming into a new environment, if you're coming into an environment that encourages that kind of thinking, where those kind of conversations are routine and are the everyday norm, I think then it's much more normal for you to start engaging with that and thinking, this is important, this is interesting, this is something I want to do, rather than you coming in and trying to develop that interest yourself or trying to start those conversations yourself. So I think a workplace culture is very important in nurturing that kind of thing. I think if you are a supervisor, it would be important to kind of bring those topics up in conversations. Especially, I think, as a junior trainee, although it does have to be bi-directional, it can be quite intimidating or difficult to bring up these conversations or these topics if you don't know whether your supervisor might be interested or might have time for you to discuss these things. So I think, especially in the initial stages, a bit of direction from the supervisor's side might be quite helpful.
Thanks, Kit. One of the things that's come up through the research that we have been doing is the supervisors or educationalist confidence, I guess, to be able to talk around some of these topics about leadership in healthcare. And I guess there's a question, do you have to be an expert in leadership to have a developmental conversation on this topic? Dal, what are your thoughts?
I'm biased, and I suspect you know what I'm going to say on that, and that's a simple no. But I think in reality, there is a tribalism here, isn't there? There's I suppose the system issues. As clinicians, especially doctors, we're not confident, we're not comfortable of not being expert at something and then supervising somebody when we're not comfortable or confident in that same topic. And so we see that responsibility of supervision very seriously, and it should be taken seriously. So actually, if you are going to support somebody's development, you have to have some degree of confidence and competence. And that's the reality. I think the other challenge that we face as those who are supervisors, or I suppose the doing of the development conversation, is that the system sometimes sets us up to fail. So the system is at the moment rife with blame, productivity. That's not a space for a learning organization or growth organization. In a sort of learning organization, there's a developmental stretch. People won't be doing things the best way or the right way because they're still learning. Mistakes will happen because they're still learning. There'll be a period of transition, so things might not be as efficient and you will have lower productivity. There's periods of not knowing, and that for certain tribes, certainly doctors, we're not comfortable with not knowing. So, there are systemic issues that don't help us. And then there's, I suppose, your own head that says, I need to be more confident and competent. And actually, so I should be having these conversations as I have no idea what I'm talking about. And so it is really challenging if we're asking our clinical leaders who've had no training or development themselves to be leading these very conversations. And I think what I would say to them is be pragmatic and use your common sense, because you have been leaders, you are being leaders, and there are stuff that you have learned, but you perhaps haven't categorized it as leadership development or leadership competency. But we don't make it easy. We certainly don't make it easy.
Yeah, agreed. And I think there's also something about coming at this for supervisors and educationalists with the development mindset themselves. So actually, you don't have to know the answers. Having that sort of open questions to engage in conversation and use that as a learning opportunity for yourself to get perspectives from others is also helpful for you and helpful for them. So yes, I agree that the environment isn't friendly to that, but there's certainly opportunities. One of the it would be very remiss if we didn't bring up technology, AI, all of those sorts of new things on the block and what role they play potentially in supporting developmental conversations or development in general. And I just wonder, what are your thoughts on how technology can or does or may help leadership development? Justin, can I come to you first?
Yeah, sure. I think there's no getting away from it. I think, the technology is developing at such a rapid pace that it's becoming part of what we do. I think most conferences you go to now will include some sort of section on AI and robotics. So I think there's definitely something about including technology in development conversations. Just practically, the technology itself has made it much easier with things like Zoom and Teams. You don't have to have that conversation face to face anymore. You can offer your trainee or your supervisor a degree of flexibility when it comes to those conversations. And so I think it's definitely something that should be part of it. How it improves learning, whether that be your clinical learning or your educational development, it's an opportunity for trainees to express their interests and how they develop in that area, and look at how they can mark make their mark in that sort of field. I mean, there's lots of different fellowships now to consider as well, and opportunities. So I think for a supervisor, it's getting that support as well. We said earlier in the conversation that actually there's a lot about peer support for for trainees, but there's also a lot of opportunity for peer support for supervisors, and knowing who the right people within your organization around digital development, who can you turn to get that support to provide your trainee with the right information on development opportunities and educational opportunities as well.
Thank you, Justin. And Kit, what's your experience been around using technology as part of development and developmental conversations?
Yes. Well, I think, just to start with, I think technology definitely can't replace these conversations, these human conversations and perspective about development and leadership. But of course, there's no getting away from the fact that it's here to stay, and we need to adapt to the way we work and to the way we think about technology and the way we do things. And I think, as Justin was saying, just even in the way that people are accessible or can be flexible with their time, it's made a huge difference. I'm able to meet with my supervisors, for example, when we're not physically in the same place. And even something as small as that is really helpful, especially when we're working in such a pressured environment and we can't always find the time to meet face to face. And I think it's also interesting to think about how things will change in terms of how it can facilitate these conversations and these developmental aspects going forward. So even if it's not directly contributing to the conversation, it will change the way we work. How can we use technology to work in a more efficient way that will free up a bit more time or resource to go about these conversations that need to be done by humans, for example?
Absolutely. All really good points. Thank you. And Dal, what are your thoughts on technology and leadership development?
I mean, it would be a little bit boring if we all agreed. So I'm going to be a bit contentious right now. I worry about technology because it's one thing if it's a trigger for more leadership development. So how do I behave in the AI world, or how do I behave in the virtual world? So it's a trigger for me to expand my perspective, my thinking, my knowledge, etc. And then there's the other thing where it's the way we develop. So is technology, AI, simulation going to be the method for our development? And that really worries me because actually, we all know that the context and the environment is so important. There isn't just one way. You have to navigate yourself within the system, and that context is so important. The nuances of responding and, I suppose, dancing with the system is incredibly important if you're going to be effective. So if you have one way, one method, one script that AI simulation may suggest, you're going to miss that nuances. And I think that's one problem. I think the second for me is that there may be a risk that we'll focus all our attention on horizontal development. And what I mean by that is, again, becoming more knowledgeable, more skillful. What we really need in the world of VUCA, in the world of complexity, is more vertical development. How do we become more sophisticated in our thinking? How do we become wiser? And I don't know if technology is going to help us to really grow in that perspective. I think it's more going to be orientated towards the horizontal. So I really do worry about the technology. And I recognize what Justin and Kit are saying, but I do worry.
There's something here, isn't there, about leadership is relational. It is about interacting with other human beings at the end of the day. And as you say, Dale, being able to navigate the rather complex and political environment in which we work as well. So having those skills to be able to have those conversations and effectively sort of navigate and lead requires that sort of human interaction. So there's a risk here, isn't there, that actually that if there is an over reliance on technology, or if technology is used in the wrong way, is that things go badly. But equally, your conversations, your developmental conversations or educational conversations that might take place between a trainee and a supervisor or anyone else could also go badly. So how can we sort of mitigate some of the effects when something does go badly? How do you rectify that and improve upon it for next time? Justin?
I suppose it depends on the extent of how things go badly. I think if a conversation's been unproductive, there's ways and means of both the education supervisor and the trainee looking at changing things up. But I think at the end of the day, there needs to be a culture of openness and the trainee feeling safe to speak up. I think that's the key. And if they're unable to, if they don't feel comfortable to speak up, they need to be aware of the other routes of speaking up. As Kit mentioned earlier, other consultants within the department, peer support. But one that people tend to forget is that your PGME or medical education department in your organization, there are people there that you can seek advice from, get some help, to try and get back on track with your supervisor, or in any other sort of ways forward. So I think really being aware of what options are open to you and speak up. Because that's the thing. If you just continue, it just nothing gets solved. It just continues, and if anything, it just continues and gets worse.
So there's a degree of proactivity, isn't there, and actually a sense of responsibility around your own development as well. Kit, do you want to add to anything that Justin has just said there?
Yeah, I guess from my kind of own personal perspective, when I feel like something has been less than ideal or it hasn't quite been what I envisaged in my mind, I think my first step is to think about what about it made it bad or less effective. Because I think for me, that's the first step in identifying what the issue was. And then I can go about thinking about how to rectify it. So was it something to do with the physical conditions? Was it something to do with not addressing the topic that I wanted to discuss? And what was the reason for that? Maybe I didn't go into it with enough preparation. Maybe I didn't make my intentions clear, or maybe there was, like Justin said, maybe there's a more fundamental problem with the trust between the parties and kind of that relationship we have. So I think the first step for me is actually just thinking about why I thought it was bad, why it made me uncomfortable, and then going about trying to address it. And I think it's the second point is not necessarily a mitigation strategy, but also just a point about, okay, fine, something might not have been ideal. It might not have gone exactly how I planned, but actually, is there still something useful I can take away from it? And I guess it goes back to the point about degrees of how bad you think it went. But from most conversations, often there is something you can take away from it.
Yeah, great points. Thank you, Kit. And Dal, what are your thoughts? What's your experience around this?
Yeah, it's perhaps extending on the simulation AI, but I suppose back to reality that we sometimes get too tokenistic. It's that cosmetic approach to anything, which is, let's think about quantity rather than quality, which is an absolute disaster. So we need to safeguard the quality as opposed to the quantity. And I think there's a really simple litmus test for those who are being developed. Have I learned something new or different from that conversation? And for the person who is, supporting that person who's been developed, did you learn something new or different? It's a really simple litmus test after that conversation that, that's completed. But if we don't safeguard that, we really are not growing and developing. And it's just tokenistic, and it's just all about quantity.
Goes back to what you said earlier about being a tick box exercise then.
And not being a robot.
All good points. Yeah, that's great. So we're nearly at the end, and I'd be really interested in your top tips. So what advice would you be giving to those that are involved in supervision and education of trainees and or trainees themselves with regards to embarking on more sort of fuller and supportive and useful developmental conversations?
I think my point would apply to trainees and trainers. I think, as we've said, leadership development is multifaceted, it is multi-directional. So I think just have an open mind to things. You never know where you might pick up something. You never know who has something useful or developmental to say, or what you might find interesting. So I think having that approach and that mindset can help you make the most of more interactions.
Great points. And Justin?
For me, my top tips would be preparation. Again, both for the trainee and the supervisors. Prepare for your educational conversations. We have mentioned today that the short corridor conversations are useful, but for development over a long period of time, 6 months or a year, you need more in-depth, prepared for conversations. Even down to your space, making sure you have a space that's dedicated and you're not going to have any interruptions is so important to give each other that attention that you need. And then, as I said earlier, thinking about what you want to achieve out of that conversations. Manage each other's expectations. Be clear on what's the purpose of this conversation. What do we want out of it by the end of it? And just so you got something to aim for, I think is good. So definitely preparation is my top tip.
Brilliant. Thank you very much, Justin. And Dal, you've got the last word.
That's dangerous, isn't it? So I think, Kirstin, in our modern world, technical skills and knowledge have a shelf life. That's the reality. And I think for us as humans, we really need to build on our superpower, if you like, our asset of curiosity or creativity. So what I would really like to do is really encourage trainers and trainees to really sort of have a commitment to nurturing that innate curiosity and creativity, because that's what's going to allow us to survive and thrive in the future.
That's an excellent point to end on. Thank you very much, everyone, for your participation today. So Kit, Justin and Dal, thank you so much. This has been really useful. I hope our audience are going to find it really useful too. Thank you, and see you next time. Thank you for listening to the Healthcare Leadership in Action podcast. If you want to learn more about what we do at the Faculty of Medical Leadership and Management, check out our website on www.fmlm.ac.uk, or you can follow us on social media. We're on X at FMLM_UK, or you can find us on Facebook and LinkedIn. Thank you to the Dinwoody Charitable Company for sponsoring this project, and to our producer, Dr. Sharia Khan, and our advisor, Dr. Raquel Sim. We'll see you in the next episode.